That's when we drink yogurt.
Yeah. Drink, don't insert. My God, listen, I've seen a lot in this online. So
Did you
drink, don't insert. Eat the yogurt, please. I've said.
with your mouth?
With your
The one that's on your face?
because you'll tell someone to go and use probiotics. I mean, get probiotic yogurts for probiotics, and then you find they have been actively feeding other body parts. There are women who've even bedazzled before the appointment, and I'm like, imagine, wrong audience.
What do you wait? Oh, sorry, mother. What do you mean? What do you mean?
You shave or you wax, and then you go and put for us to jewels and to stones. Maybe I'm telling you, this job.
Are you saying I'm not taking care of my coochie? There's some stuff for coochie stuff.
Yeah.
No, but that's too much, guys.
Yes, I think so too.
That's too much.
And especially for the gynecologist.
Yeah. Hey guys, welcome to another awesome episode of Kwambox's podcast. And if you're new here, we are about to unpack some amazing conversations. But first, I want you to hit the subscribe button, notification bell, Pia, so that when the episode drops, you know exactly when to get it. And share. Let your friends know that we're having important conversations here on Kwambox's podcast. I'm privileged because this next guest is not only a friend, she's my personal gynecologist. And I dragged her here because I found out that Kenyans are not going to the gynecologist. She is a world-renowned and world-acknowledged gynecologist, OBGYN, who has seen a lot and can share a lot about women's reproductive health. She's actually a voice, and not just any voice, a recommended voice. And that's very important. Unasikia hapo pale nimesema recommended. Why? Because just today I was giving someone a lecture about sharing with me a video from a doctor. Ati put salt under your tongue and drink water. Yeah. So, without further ado, we're going to talk about why you need to go to the gynecologist. This episode is called Down There. Dr. Claire Kinuthia.
Thank you. Amazing introduction. Thank you.
Well, renowned and recommended.
Recommended,
okay,
on women's health.
Yeah, Doc. It's so. I'm so happy to have you here.
Thank you for inviting me.
You know, now we are talking.
Yeah.
You know, I'm not telling you about the problems.
Switch house.
I love it. So before we get into deep details, I want us to clear again.
Okay.
Right?
Okay.
So you just had the introduction I've given you.
Mm-hmm.
Kenyan women are not going to the gynecologist. For why, we don't know. I'm going to tell you, we put out a poll and asked Kenyan women on our Boxport channel. If you don't follow us on Instagram, please follow us right now. We are Boxport TV. So yesterday we put out a poll asking ladies, let me just find the poll. Have you had an awkward story at the gyna?
Mm-hmm.
And the first was where? Let me DM, 19%.
Mm-hmm.
It's been smooth sailing from day one, 19%.
Mm-hmm.
63% said, I've never been to the gyna, right? I've never been to the gyna. And there's lots of DMs. There's even a guy who DM'd us. Let me read you this comment. He said, I became mad. No, he said, my girlfriend just went to a gyna 2 days ago, and she said she was served by an old gynecologist man. Right? This is definitely a Gen Z. So it's like, yo, why is this Mzai looking at your coochie?
Right.
So this is where we are.
Mm-hmm.
Ladies are not going to the gyna. What's been your experience?
That's very true. It's one of the challenges we have in gynecology, because then the Kenyan population forces us to practice curative medicine instead of preventive medicine. The ideal is come in when you're okay, we check, and keep you okay.
Sorry, doc.
That's the ideal.
So you want
Kenyans to be when they're in pain,
yeah,
there's fluids that they don't understand, or something else is wrong, and that's when they'll come in. And yet a lot of the things that we're treating you for were preventable, or we could have put it in a place where you didn't have to suffer as much.
Yeah. I get that, but I know there's somebody right now who's like, hold up.
Out of my own free will.
You want me to just be like, by the way, Stacey, unafanya nini Saturday? Hata sina plan. Sijui niende kwa gyna. Hivyo tu?
Yeah. In fact, if anything, I tell my patients, make it a birthday treat for you, birthday man. come in and just have a checkup. Because a lot of the conditions that we do suffer from as women sneak up on us. And by the time you're coming in, you're probably, and that's why you keep hearing, especially like cancers, a lot of women tell you I was diagnosed as stage 3 or stage 4, which is really late in the game. It's because we could have caught symptoms ages ago, or we could have found signs that something is off if you come for the checks. So like by the time, for example, you have an obvious breast lump with breast cancer, you're pretty far along. By the time you have symptoms of cervical cancer, we are actually now end stage. So these are things that if you come in, there's tools that we have for screening that catch things very, very early, where you're either precancerous or we can see the lump and take it out and test and treat you preemptively much earlier on and have better results.
Ebu, let's stop here so I can tell you about something amazing that's happening. Yeah, we're still going to be talking to Dr. Claire, but guys, have you heard about Via Health Solutions? Oh, you haven't heard? Well, let me tell you. It's time to take a proactive step with your own healthcare, with your own health. It's time to know what's happening here. And the best way to know about it is not by waking up and going to the hospital. No. You need Via Health as your healthcare partner, because this is what happens. Let's imagine you want to get tests done. You don't need to leave your home, okay? They come to your home, they take the test, and then they send the results electronically. That's not all. They've got this amazing product. It is a contraceptive and it's self-administered. But for the first one, you will have to go to a Via Health pharmacy to get it administered. And then after that, you can order and they will bring it to your house and they will direct you how to get it done. Listen, Via Health Solutions is telling you you need discretion, you need privacy, and most importantly, it's convenient. It's time to take a proactive step with your own healthcare. Now, what's really going on? Holla to Via Health Solutions. Okay, so now that you busted that, my futures are actually even hard to believe. And to the guy who's saying his girlfriend's gynecologist is an old man. Now, this could be a bit of a deterrent, right? Because for him, he's like,
yeah.
What are you doing? Yeah.
We've come a long way. When I was training back in Enzi Zakale, we were mostly male gynecologists. Women preferred to go to male gynecologists. So like majority of classes when you are training, you'd find there were men. My class was the first one where we inverted the numbers. We were majority female, and maybe in a class of, if we were 25, I can't remember the exact numbers, but it was like 20 women, 5 men. And that class was considered problematic because people didn't see who was going to see the female gynecologists. Because that was the mindset at that time, that you trusted a man. Most women you'd hear say, I don't believe a woman will look at me objectively. She'll be judging me. She might mess me up because she's jealous. And I'm like, wait.
That is so crazy.
Wow. Okay. So sitting now, watching that the narrative has changed like full on 360. Most women now prefer women gynecologists. We are more in the industry as well. So you have options. You don't have to see who you don't want to see. Yeah. That's the reality. So if you prefer a male, you see a male. If you prefer a female, now you have actually a variety of options.
You could see who you prefer to see. And that's very important because, things like traditions, cultures, religion could deter you from going to see a gynecologist because you're like, it's a guy.
Yeah, exactly.
Right?
Exactly.
And also, it's interesting you mentioned that because when we were growing up, our folks were all about, Dr. I don't want to mention names, Dr. Karanja, Dr. Swangi, and then they'll say, I swear by that guy, and then you'd hear, comments like, and honestly, when I was a kid, I didn't know any better. And then when I went to my first gynecologist, I was like, I don't think this is kosher. And it's what you just said. Go to who you feel you prefer comfortable. You feel comfortable with.
Yeah.
All right, let's play myth, madness, or medical.
Okay.
All you say is it's either myth, it's madness, or it's medical. Okay. Right? You only need to see a gynecologist if you are sexually active.
That's between myth and madness.
Oh. Because you just said we need to go every time. Yeah.
Let me be kosher with it. Let's go with me.
Yeah.
Yeah.
So okay. The first visit is always painful.
Madness.
What would someone think? Why would someone think this?
Because your friends tell you, your aunties tell you.
Mhm.
And I accept it. There's been women who've had really bad experiences. I tend to think it comes from a point of misinformation or no information at all. So you come into the gynecologist expecting something to happen, but you don't know what. And then when it does happen, because you're tense, you're scared, you don't understand. And then we didn't have the training to talk to the patient, talk you through the procedure or what we are doing. And also pain relief was never a priority for a lot of doctors. So then a lot of women suffered. And now when I have a bad experience, I'm going to tell my girlfriends, I'm going to tell my children, my daughters, I'm going to tell my nieces. So when they come in, they have the same, in fact, they carry your trauma. So they have the same expectation of suffering.
Yeah.
But now, as the doctor, if you're able to recognize, like for me, I'll talk you through it. A lot of first time with a gynecologist doesn't even involve a procedure. It's a conversation. Because it shouldn't be that we've just met and then, unless you actually have symptoms, which is I'm talking about preventive medicine. If you come in preemptively, you're saying, I'm just coming in for a checkup. That first visit can just be me taking history, getting to know you, you get to know me, you start to feel like, is this a safe space for me? And then we can plan procedures for your next visit. It doesn't have to be all invasive. If you're panicking, truly I can see you're panicking, I'll tell you, listen, maybe not today. Maybe go think about it. Let's go pray about it. Calm down. Then come back in. And if you feel more comfortable, I'll be able to get better consent from you. You'll be able to relax through a procedure.
Doc, you be telling people to calm down, go and pray on it, and they're really there with the funky snort.
No, that's again, what if you have symptoms? You come in before you have symptoms. I'll keep emphasizing this.
I like that. All right, so I hope we're learning, and I hope you're writing down the answers here. Doctors judge you based on your body count. Now, these comments, we got them from responses that people were sharing with us that these are the reasons why they're afraid of going to the gynae, that doctors are going to judge you based on your body count.
We don't care. The good doctors don't care.
I want to know, how would you even know someone's body
count? Take history. It depends on how thorough the history.
You ask someone.
My primary department in obstetrics and gynecology is your sexual health, right?
So you can look and be like, this one.
No, I'll ask.
It has
it's not a question. No, it's a question. I'll ask you. But usually I don't need to know the numbers. It's usually age when you first started. That's as much history as you'll have. Some women will overshare and then tell you numbers, and then now you might get negative feedback. There's also the biases. We're not supposed to project our personal beliefs or biases onto patients, but it does happen. It does happen. Yeah. It shouldn't. It's not supposed to be the normal.
So if a doctor asks me, yo, how many people have you been with?
There's something off. It's not a question. It's not a question we need to have. Yeah. The only time we'll ask you to maybe disclose partners is if we've diagnosed you with an STI, sexually transmitted infection, and we need to do contact tracing so that they can also get tested and treated. But usually, given the setup in our country, we ask you to do it yourself.
Yeah, because I was going to be like, you are going to reach out.
Officially, we should. That notifiable diseases. So if I'm diagnosed, for example, supergonorrhea, I'm obligated by government to report to the government and
my business.
And track down all your partners so that everyone gets treated and tested, because now it's a public health issue.
And this is why people not be going to the gynae. Okay, no, I didn't know about that. And so it's interesting because you hear that. So if someone, this which is a side note, if I come to if I come to you and you find out that I have supergonorrhea, and I say, yo, me, I'm not, watch a John take a coffee.
Right. That's a tricky situation because, again, it's not enforceable in a country where we don't have systems. So again, here it's difficult to enforce, but we should notify. We're supposed to be able to notify, just like TB. There are some diseases that are notifiable. And if because it'll become a national health issue, because if you're not treated, you will spread it. And because something like supergonorrhea doesn't have proper treatments, or it's resistant to pretty much every antibiotic, then it becomes a national health issue because everybody in our population can easily become a victim.
That's so wild.
Patient.
I hope you are taking care of yourself. You should clean inside with special products.
Madness. Not that I don't even have to think. Pure madness.
But there's
don't clean inside.
Okay.
Stop.
Yeah.
Madness. Kill that one, kabisa.
Yeah. No, for sure. Ladies, if you're using products inside is inside. Irregular periods are normal. No need to check.
Myth. That's a big myth. And regular. So again, because of lack of information or education, a lot of women don't understand regular doesn't mean same exact day of the month.
No.
It's how many days is it between day one of one period and the next one. Because if you're counting on the calendar, you'll say that my period was 20 something. It came on 29th. The next month it came on 16th. Then the next month it came on 7th. Then it's irregular. But it sounds like a very regular cycle if you count the number of actual days. So it's not calendar days, it's the days between day one of this period and day one of the next. Nowadays we have apps. You don't have to do any math in your head. Just keep putting it in the app and the app will tell you whether it's regular or not.
Sorry. How are they doing it back then?
Counting. We had beads that we used to wear that looked like a rosary on your arm.
Yeah.
Women would count days on that. Or count actually in a notebook or on a calendar.
No, until before we could write. Like our short degree.
They used to, in fact, they had better tracking systems because they track for seasons. They track like crop seasons, the animals. They had even better systems. They didn't need to write anything down. So they knew when something was wrong.
Yeah, you're asking us to remember shit and I can't even remember people's names.
This is why there's an app.
I know. But then, you know what they said about the app? It was tracking what they were selling. I was like,
careful which apps, but there are
to me a calendar. It's like, okay, this day.
Special my period.
I have a friend who tracks mine because it says my I'm a different animal. So you put it on his calendar. Yeah, and I don't track mine. But I'm an adult. I've been doing this for a while. So I know when they come.
Yeah. And you know when something is off.
Yeah.
Yeah. If you've started to be self-aware and understand your body, you will tend to know, even without checking the app, you'll be like, gotcha. This has been a season and a half. Where is my period? Yeah. And then you'll know something is off.
Okay. So you can tell something is wrong by just how you feel, which you just answered. If it doesn't hurt, it's not a problem.
Again, it's madness.
No, like if I'm not feeling like pain, but then it's like a bit of discharge, and I'm like, okay, it's not like green, so I can manage.
So we wait till it's green. That's the question I have.
Doesn't the body? I mean, doesn't the body deal with some of these things? You know, like God created this funk machine.
But do you know what these things is?
Exactly.
That's the question. You can sit there. Okay, let me put it like this. Women tend to not present with symptoms, especially not severe ones, for sexually transmitted infections. Men get pain, razor sharp pain when they pee the day after. Women may go even months, even a whole season of their life without realizing they got chlamydia or gonorrhea. Not a symptom in sight. HPV is asymptomatic until it becomes cervical cancer. So for women, it's a very, very bad thing to use pain as an indicator. Because by that time, like I said at the beginning, we'll have gotten to a point where we're beyond repair. And remember, a lot of these STIs for women cause complete infertility. They'll go up into the pelvis and block the tubes. And now you can't conceive. So the first time, unfortunately, we'll get a lot of female patients coming in for an issue is when she's now married, trying to have a baby and not able to conceive. And when we do the testing, the tubes look like they have glue inside. When we test, historically, you have had chlamydia or you've had gonorrhea and just didn't recognize.
Sorry, what did you say? The glue inside?
Yeah, they just stick. It's messy. It's like, it's a gunky, fake discharge that goes now up into the pelvis, because usually it's maintained until, like you said, the body knows how to fight, but only if it knows what it's fighting. So if it's your first encounter with an infection, and a lot of these STIs need to be treated, they can't be cleared by your immune system on its own. So you will find that it will ascend. So your immune system will fight by keeping it in the vagina for as long as it can, but soon it will start to go up in the cervix, into the uterus, and through the tubes into the pelvis. So a lot of women come with what we call a pelvic abscess. They have pus in the pelvis from an STI that they didn't know they had back in the day.
You know, I just had someone today describe a scenario that they went through when there was pus in their stomach or something. I'm not sure because I didn't, it's the internet.
Yeah.
I don't have time to watch everything.
That's available.
Long formats. I'm just saying, you should give us a short synopsis of what the shit is, right?
Yeah.
And they were talking about like pus was being removed from there. And I remember also, I think about 4 episodes ago, we were seated with Joyce and we're talking about reproductive health. And they were like, we were talking about UTI, urinary tract infections,
yeah.
which, you are not STDs, and I think a lot of people think they're UTI. And I was talking about like it can go and become something else, and just like
it can send you into renal failure. Your kidneys will shut down.
Can you imagine?
Yeah, but that's because again you're waiting for pain. You're waiting. You can feel something is different, and you're waiting for pain. By the time you get to pain, your kidneys are probably, we're talking dialysis. So it can be very, very severe. A lot of the infections we end up having or symptoms that we have is because the body has really tried.
Just been fighting to say,
it's like, please now, please. Please get help.
That is so wild.
Yeah.
Okay. You should be embarrassed if you smell. Now, this particular one, I think we had an episode on right here on Boxpod. If you missed it, we're gonna give you the link somewhere here on the screen so you go watch it. And we're talking about how when you were a kid, you go to the salon. And you've been pelekwa there Kenyatta Market. I'm not saying this be so Kenyatta Market or walikuwa na nini. But you go there, mazee kichwa hapo, and you're just
the whole.
My guy, you have your breath. You can literally be an underwater swimmer.
Yeah.
And it's because of the smells. And this comment, I thought it was just something that a few of us who have gone to salons here in Nairobi have experienced globally. This is the thing, right?
Yeah.
And then men jumped into the comment and said, "You haven't been to a matatu lately, have you?"
Oh.
Exactly. I see your eyebrows. I have to tell you, sister. Msichana nasimama kutoka kiti unasema gai nimekunusa hata before I saw you. Right? So,
okay.
Can we talk about the smell and what are the myths there? Like, is it the question here was, should you be embarrassed if you smell?
I like to take away shame from women's health because that's the way we've been conditioned since childhood, that anything to do with my body is supposed to be shameful. So I'm supposed to hide my pads, hide your tampon. When you go to the bathroom, don't make it like be quiet and, slinker out of class without people noticing. Everything to do with normal body functions, we were ashamed about. Yeah. And I'd like that to start to change because it's one of the big reasons women don't come in for help when they need it, because you start to overthink. I can smell something. I can see an abnormal discharge. Oh my God, what did I do? What did I do to deserve this? How did I do this to myself? Or who did I give access to that? It's me. I'm constantly blaming myself. Instead of coming in and say, something has happened, can we test and figure out what's wrong? It has nothing to do with me as a person. Yeah. You have a human body. It's going to experience human conditions and diseases, infections, all sorts of things. Some things are even hormone-driven. It's not even an infection. So a lot can change the normal flora, the normal bacteria you find within the vagina. One thing to take away is the vagina is clean. It's not sterile. So it's going to have its own little bacteria, a bit of yeast cells, some protozoa, some different microorganisms to keep it healthy. The main thing is this lactobacillus is the primary bacteria, the one that you find in your yogurts. Probiotics, what you call probiotics.
That's why we drink yogurt.
Yeah. Drink, don't insert. My God, listen, I've seen a lot in this show. So
did you
drink, don't insert. Eat the yogurt, please. I've said.
With your mouth. The one that's on your face.
Because you'll tell someone to go and use probiotics. I mean, get probiotic yogurts for probiotics, and then you find they have been actively feeding other body parts. So no, please. Consuming please. This work.
This must be those TikTok doctors.
Yes.
You know, you are doing it all wrong. Have you never put yogurt in your coochie?
There's a lot of misinformation out there, and that's one of the things to address. So we have lactobacillus, which is the primary bacteria, and it keeps the vagina acidic, which then suppresses all the other microorganisms to small levels. Now, when you have overgrowth of those, then you have a yeast infection or you have bacterial vaginosis. Or you have any other like localized infections. It didn't come from outside of you. It's growing because of a mixed match of the balance of the normal. And that can be because of hormones, can be because of stress, can be because of extreme diet, extreme weight gain or weight loss. So a lot of things have nothing to do with you doing something directly to cause yourself harm. So if you keep associating shame, you should be embarrassed. The thing is, tell the person. Sometimes, again, I've noticed self-awareness is a very personal thing. Some women are just not aware. So if you can find a way, in a polite way, if you're close enough to just maybe have a bit of a checkup, because sometimes it's not even an infection, it's just BO. And so that can be addressed in different ways.
I'm telling you, from my experience,
there are just some people who have no awareness. I promise you.
No, but it's true. It's true.
That they are like, I'm just walking around. I just don't know.
It's true.
Sometimes it can even be the fabric you're wearing. You're wearing something that's not breathable. So by halfway through the day, there's a funk going on that truly you're not clean.
Yeah.
It's just the fabric was just not breathable.
Yeah, what's up? Like, ladies, can I just put it out there? Like this, I think I don't want to say silk. It's not silk. There's this Kazimia silk way designers who jump in there and tell us there's an actually fabric that when babes wear.
Yeah.
Me personally, like I've just showered, I've put it on, I'm stretching to. I'm like, what's that smell?
Yeah.
I'm like, it has goes out my armpit, and now I'm just like, yo, whatever chemicals you are, no, get out of my body. I'm not wearing it. Yeah,
there's some fabrics, and especially this fake poly something that looks like leather. It's completely unbreathable. It's as completely.
Oh, then it's called clever.
Leather. That's why. Yeah. If you're wearing tight fitting clothes that are made of that fabric, you will smell regardless of what you do. Yeah. So you also have to think about your fabrics. If you can go with more natural fabrics, the better.
Yeah.
Or looser fitting clothes. These are always ideal. Yeah.
Hair or no hair matters at the gynecologist.
Truly don't care.
You guys, you're not at where's the Brazilian?
It's not for me. And listen, there are women who've even bedazzled before the appointment, and I'm like, imagine. Wrong audience.
What do you wait? Sorry, my bad. What do you mean? What do you mean?
You shave or you wax and I go and put for us to jewels and to stones. Maybe I'm telling you this job.
Are you saying I'm not taking care of my coochie? There's some stuff for coochie stuff.
Yeah.
No, but that's too much, guys.
Yes, I think so.
That's too much.
And especially for the gynecologist.
Yeah.
Truly.
I don't like. Don't. I have to tell you. I think about it. I'm like, should I take it like this? Yeah. How much should
How much should jump in? Unless there's something going on externally, we're barely ever looking in that direction. My interest focus will be specific. Yeah. So we would not. Again, a well-trained professional doctor. Yeah. It doesn't matter.
No, but I think here we should say washed hair. If you're going to keep it like I think basic
hygiene. Yeah. That should be the primary goal. Don't postpone your doctor's visit because you haven't had your wax. Don't do that.
That's wild. But I like this. I like all these questions and things that you guys put here because I'm just like, guy. And the last one is men don't need to know anything about this topic.
That is where we have so many problems in reproductive sexual health. It takes two to tango. I'll keep insisting. And especially when it comes to reproductive health, we'll always see the female and she will always blame herself if she's not able to conceive. And yet 50% contribution comes from her partner. The partners will never come in. They don't want to get checked. They don't want to know if there's a problem. Then we're like, but then how do we fix the problem? So the standard average gynecologist will tell you if there's a subfertility issue, the woman will come in, will test all of the things we need because female fertility is more complex. So there's different types of causes of infertility. We'll check her extensively. Everything comes back normal. Then we go like, okay, so now, as much as we've postponed, he has to come in for testing. She's like, no, let's do what we need to do. He doesn't like minus him. Then I'm like, then you need another partner. Because where are we getting sperm from? Do we even know the quality we're dealing with?
Yeah.
You're fine. I don't have, your partner is a question mark. So then how can I advise or even support you getting pregnant? How does that work?
Yeah. And I think we recently posted a video online to share, especially about sperm. And it was basically the mansplaining, fertility and reproductive sperms to a man, right? And it was this video of the different types of sperms. There's one that's G as a neck. There's an one that's too skinny, so you can't shade. The one is just, it's aimless.
That does just vibrate.
You go to Avanyanje, 2 times, 1 time, and there's a guy, it's just like you're going to give her a kg of swimmers. And they're like, just like, they were, only my guess is chopper laps around the bones.
Lack of education on this subject. If you're seeing ejaculate, it doesn't mean it contains sperm. Ejaculate is all the fluid that comes from all the different organs, including the prostate, and that will come out regardless.
Is that pre-cum?
And cum. Like the semen versus sperm. There's a huge difference. So semen is what you will see, basically. coming out.
That is semen.
Yeah, inside that semen, there should be healthy sperm. You don't know unless you've tested, or if you live a healthy lifestyle, then you can guess that they could be okay. But many things will affect sperm production. So you get new sperm produced every 90 days in a month. So every 3 months, you're having fresh batch. So in a previous batch, if you're a heavy drinker, heavy smoker, if you, and I think I've described, I don't know how much of our population.
Stop judging yourself.
If you are overweight, if you're just not healthy, you're not fit, it's very likely that you have very, very poor swimmers. So the fact that you're having ejaculate come out doesn't mean that there's healthy sperm. Remember, even if you've had a vasectomy, you still ejaculate the same way. There are just no swimmers at all. There's no sperm in the ejaculate.
Wait, so vasectomy, there's not that they're just like, oh, God,
no. I've had that so much of.
I thought that's what. I thought that's what happened. It's like, the swimmers went come out, but like, get me
Physiologically, I promise you, nothing changes. Obvious changes. Like even the incision itself, once it's healed, you can't tell that they've had a vasectomy. So that's where women get caught on, I'm trying to trap someone, but he doesn't big swimmers had a vasectomy. But you're not going to physically tell. There's going to be semen, amount of semen at that.
Do you know how mad that would have had an argument again? And just say, you told me you got a vasectomy. What is this?
A vasectomy doesn't change what comes out, except for the fact that there'll be no sperm in the ejaculate.
Oh, wow. Yeah. That's why we had to have you here. Because if that TikTok doctor was like, 3 reasons why you shouldn't trust his vasectomy. I'm like, that's so calm.
Yeah, so this has failed.
That's crazy. So, I mean, now that we've done Myth and Madness, and even for me, some of those, and I come to you often, and I'm just like, a lot of those to me sound like medical, but it turns out they're Myth and Madness. Actually, there's none of that was medical. But let's get to the medical stuff. Like, what should someone who's going to Gynae for the first time expect? I know we kind of touched on it, but like, and the reason I'm asking this is because we've had instances, and I want to play you a clip. A lady, and this is from Congo, if I'm not wrong. When you go to the gynecologist, like you've said, we come from a community where a doctor, lawyer, hawa ni waheshimiwa, right?
Yeah.
No, I'm just talking about our subconscious, what has been positioned there. So very few people have even the confidence to ask the doctor, sorry, what are you thinking? Right? Or where did you study? Because it's not, I'm not being rude, but I just want to know your qualifications. Or, doc, I saw this. What are they? They don't even want to have a conversation. And so, even for this clip that I'm about to play for you, it's a lady who's given birth, and you do. You don't just look at the vaginas; you also
deliver the babies.
Come here. And so, when ladies have mentioned that you go to give birth and you have your whole plan. I'm gonna push. I'm gonna push till December, and then they walk in there and they say, "Sasa tonight we're doing C-section," and it looks like it's a thing. So you can imagine there's all this online conversation about why it's important to have a natural birth vis-a-vis C-section, and that's a conversation for another day, right? Yeah. But this lady then chose not to have the C-section, right? And like you said, nobody's like explaining to you, okay, Maya, this is what's happening. And what happened next was heartbreaking. Run the tape. What's happening is basically,
oh my God,
she is being told now that she needs to be sutured.
Okay.
Right? After
the delivery.
Because, things happen.
Yeah.
And so she doesn't want to be sutured.
Okay.
Which is her right. And clearly it's a need for communication.
Yes, yeah.
Because what happened next is the bias. You're not going to talk to me like that, you woman, yada, yada, yada. And he proceeds to slap her and beat her up. And she's just giving back. So she's bleeding. This happened in a hospital in Congo, right? And there's so many different crazy stories. I mean, I know that if people who are watching right now, who've now understood what they should expect, or what is right and what is wrong, open up to you about their experiences with a doctor. Forget even just a gynae, right? And so it's like they go in there, and even whatever happened to them, they don't know whether who even to talk to, like, this happened to me, because it's like, it's the doctor. What do I know about my own body?
Exactly.
Right? So what should I expect going to the gynae?
So definitely not obstetric violence, because that is what we call obstetric violence. So violence that happens during the birthing process. And unfortunately, like you said, a lot of things were allowed culturally that we know are wrong, and it still happens in many parts of the world, not just in Africa, it happens everywhere in the world. And the numbers are fewer because there's more visibility now, and can record and actually call these people out, hold them to account, but it has been ongoing, and it's one of the things us, the trained providers, are actually working to fight against, because it's no longer do this, madam, like here, do this. It's not instructional anymore. We actually have to communicate. So if I just address this scenario, the first thing that comes to mind is a complete breakdown of communication, because they didn't arrive there just like that. So for sure, you're not explaining to the patient what's happening. You're not talking to her about her options. You're not talking to her about the things that need to happen as soon as stage 1 happens, the baby comes. After the baby, there's a placenta. After that, if you have a tear, I have to repair it. Now, that is not the time to have that conversation. I'm of the opinion that she should have had lots and lots of prep during antenatal follow-up. Now, again, this is a point of privilege. There are women who just don't have access to antenatal follow-up. In Kenya, we do have better access because the government used to have active programs that subsidize the cost. So you had 8, I think there were 8 at the time, clinics that were subsidized or paid for by government if you went to a government facility. I don't know what the situation is currently, but that time it was actually really good. And you'd have subsidized care where you don't have to pay top premium amounts when you go for delivery. Now, during your antenatal clinics, that's the time we're supposed to explain to you what delivery looks like. You tell me what your birth plan is, what your ideal picture. You want white noise, you want us to have, blue lights, whatever comes to you, the wildest of your dreams. Write it down and tell your doctor, this is how I'd like my delivery to look. It's a natural birth. I want to have a vaginal birth versus a C-section. That's conversations to have in clinic prior to the time of delivery. Then now when it comes to delivery, the thing I'll have prepared you for is the changes that happen during the active process. Things can go wrong, I'm telling you, in literally seconds. That's the thing about an obstetrician, going to doctor, being the doctor you're with, providing you care during your delivery, is catching those changes, because you can lose a baby, you can lose a mom in minutes. And so that's not the time for me to explain to you, oh, you're bleeding heavily. Now I need a C-section. This is not that. I should have said to you before, this could happen, this could happen, this could happen. This is the reason why if I change the plan that you've had, I'm changing it because these several things could have happened. When I'm talking to you in the moment, I need you to remember the me here in this office telling you what's going to happen. And if it happens, you understand where I'm coming from. Because there's also that misunderstanding or misinformation that better after money. Imagine a C-section is much more work for the doctor. If you can deliver vaginally, I go home.
So this
even better.
So this, I don't want to call it myth, but like this common gossip that hospitals are forcing people to do C-sections.
So hospital versus doctor, that's a different conversation altogether.
Thank you.
I'm talking about
doctor.
Yeah. So your doctor is not in the mindset of, I must turn this into a C-section and give myself more work. And yes, there'll be more money, but for the work, it's literally equivalent for the work. Like, get paid less for a vaginal because you're doing more work. I'm paid more for a C-section because I'm doing more work. So if you're looking at it from a point of view of the doctor wants to change this to a C-section, that's not majority of the times what's happening. It's the baby is in danger or mom is in danger. Something has changed during our planned process for delivery. Now, if we're not communicating that antenatally before you come into delivery time, we are going to clash at delivery time. And in that moment, emotions are high, temperatures are crazy. In especially settings like now, I can imagine in an African setting, in Kenya, we also have those settings where if you're seen in a government facility or in a big hospital, you might not be seen by the same provider every single time. So it may be that you're meeting this provider for the first time. So this is why I keep saying women need to understand their rights and understand what to expect. Force the conversation. If you're in a clinic where they don't have enough time for you, maybe change the provider or change the facility. I understand also cost being a factor. So a lot of people are on a package that's more affordable, that's provided by a hospital. And so you see whoever you see. But you still have a voice. You need to understand, this is normal, this is not normal. I have questions. I have seen on TikTok this. Have that conversation with the provider. Make sure they have enough time for you. Insist. Advocate for yourself, because at the end the system will change from one-sidedness. Again, in a hospital setting, providers are overworked, underpaid. That's the reality in an African setting. So they may take out frustration. I keep hearing nurses in public hospitals are so mean, but they are going through so much. They are also human. It's not to excuse the behavior, but to understand that in that moment, go into a hospital able to advocate for yourself or bring someone with you. You're allowed a birth partner, regardless of where you are in the world. That person should be not just for holding your hand and helping wipe they should have a strong enough voice to advocate and go like, hang on, I don't like what's happening, please explain.
Yeah.
And they stand up for you, because in that moment you're not able to do that for yourself.
I don't understand. Okay, I mean, I do understand. We are in Africa. There's a lot of inculcation or things that were taught in us that, you know, you keep your head down, you don't ask too many questions. But I mean, you're talking about your body.
Yeah,
you know,
exactly.
And as much as for me, what I don't even know where I got this kirere from with the doctor, but there's no, I don't know. It's just the idea of giving you full control. To me, I guess, thank God for control issues.
Yeah.
Because even if I'm seated with any doctor, you're going to be upset with me because I want to ask questions. I want to understand what your thinking is, because you're thinking. It's not like I've just told you something and you're like,
yeah, exactly. Yeah.
In my bag of tricks, so I've got the antidote. No, it's, you know, it's like we're going to work on this together. And note that I was the first person to diagnose it because I'm the one who has come to you. So I have a bit of information. But you're right that I feel like a lot of women go into, not even women, men. I mean, I've had to do this training with my parents where you go to the hospital and you're like, what is the doctor treating? You know, you went in with a headache and you left. What's and the doctor, what are they treating? They're like, they are thinking it's this. And what medicine have they given you? They're called this and that. I'm like, I didn't ask for their romantic name. I'm asking for the composition of the dawa so that we know what exactly you're being given. And we have information right now. But you're right. A lot of people, and that's why you hear a story of Sijui, there's a gynecologist who set up in Sijui, a slum somewhere. Even as we're speaking right now, the guy was walking up, he's probably had his 4th cup of tea and he has opened his fake clinic. And he's just saying, thank you, God, for all the coochie that's about to walk in here. Because he has a thing for sick coochies. Right?
The big scandals where the gynecologist was busted for abusing women, those rape allegations, sexual abuse allegations. And when you do your background, he's not a doctor. He's not even a doctor. Forget even a gynecologist. He's not even a doctor. So how does that person get access?
This is the country where there was a pilot who was flying without seat. This is Brian Wendo's country. The lawyer who won cases may never see LSK, you know. So when you put all those things together, I know that Kenya Pharmacy and Poisons Board has come out clearly to say that they don't have enough resources. I've spoken about this. There's a time they were doing a crackdown of pharmacies. And they pretty much like every town, every neighborhood they go to, they say there's about like maybe 70% of these pharmacies are fake. But the moment they go, they tell them, okay, close this thing, leave, la. And then they go. You're not coming back here anytime soon. Exactly. I'm going to see you next year, right? The same time. So they just open. So if I'm walking into this gynecologist place, right? I might not know whether this guy is a real guy or a fake guy, or a real babe or a fake babe. How can what are some of the things that I can be able to put so that I know,
For Kenyans, it's very, very straightforward. We have the Kenya Medical Practitioners and Dentists Council. It used to be the Medical Board, now it's the Medical Council website. All registered doctors of every specialty or GPs, everyone who is a registered doctor in Kenya is listed there, whether they're local doctors trained locally or foreign doctors who come here, gotten registration. So if you don't find that name on that registry, and it's a website, the kmpdc.co.ke,
but it's this one on the screen.
We put the information. All of us are registered, and we are required to be licensed in order to practice. And your licensing is reviewed every year, so you have to renew it every single year. We do have to take classes and keep up with our education, with continuous medical education, for you to continue getting your license. And everything is automated now. You can't fake anything. So if that person's name is not on the registry, they're not a medical doctor.
And that is fabulous.
It's very straightforward for Kenyans. Then now, on top of that, now you can have a direct conversation with the provider. So once you're in clinic, ask questions. Where were you trained? How many of these procedures have you done? Are you the best? Would you recommend that you do this procedure for me? Versus, are there other ways we can do this treatment plan? This is the thing. You can't come into a doctor's office the way we used to sit there, you've said, and think the doctor is God and they're the ones who are going to just prescribe whatever happens to me. Now you have access to information, even if it's misinformation. Come with it, we discuss. Don't come with that mindset, because again, there's also the patient who comes and doesn't want anything that's being recommended at all because they read ChatGPT. No, we don't want that other extreme. But come armed with information. I have these symptoms. When I Googled or when I asked my AI, it told me XYZ. Are these possible differentials? And if not, explain to me why not. Because then we can have a proper conversation. But if you're not even armed with that knowledge, just basic information on your side, the doctor will also not, again, time is an issue for a lot of practices. So the doctor will not take time out to start teaching you medical jargon and big scientific detail. They'll only tell you what you need to know. And that will be, this is what I think it is. This is the medication to take, or you need this procedure to be done. And then we need to organize for the procedure. So you can leave there with even less information than you came with. So you do have, there's a due diligence you have to do in yourself of understanding, I'm going in to see the doctor. Why am I going in? What symptoms am I concerned about? What are the issues and how long have they been there for? Give as much of a thorough history as you can give so that this person can make a proper diagnosis. If you don't feel like you're being heard, because there are those moments where the doctor is like, you've told me enough. I'm not even looking at you once. I've written the prescription and I've moved on. Call them out. It is your right. It is your body. So you've given me medication for what exactly? We haven't run a single test. You haven't examined me. How did we arrive here?
I love that.
Have that conversation. You are in charge of your own healthcare as well. Have that conversation. You don't need to be combative. It doesn't need to be a back and forth. If this provider is not in a space to be able to receive the questions and understand what you want to be taught, find someone else. And you have so many options. That's the reality with it.
I love that. And if there's a woman who's watching us right now, she's like, okay, cool. Reproductive health. I've never even taken about down there. I just know it's the place for pleasure and IP. And a kid is going to come out of there one day. But I've never really paid in close attention. What would you say is a common mistake that we make on reproductive health? Right? Like, we've already spoken about like things that like wash, products. Actually, our products, like, should I be using wash or just, because for me, I believe in water. So cleaning, so first, like I said, the vagina is clean, not sterile. So you don't need, it does its own thing. And then gravity is our friend. We are upright. We evolved to be upright. So anything that's in there comes out. And that's what discharge is. It's just a cleaning of the system. All you need to do is clean externally, the vulva. So not in the vagina. Leave the vagina alone. And then you don't need soap. You don't need, especially not perfumed antibacterial. Those we go and change the normal flora we talked about. So you just need clean water. If you're showering as the soap goes down, that's fine. If you're on your period and you want to be a bit cleaner, then a very simple plain product that doesn't have perfume, doesn't have any harsh chemicals, can be used to clean, again, externally, but it's not something you need to do extreme. But if you have BO, like we've discussed, if you have body odor issues, then there's products that you can discuss with your doctor to see what's safe. Generally, you don't need feminine hygiene products unless you actually have a medical issue, and then it's prescribed to you. So I see women who wear panty liners every day. I wouldn't advocate for that because, again, you want breathable cotton fabric against your vulva on a day-to-day basis. When it comes to now treatments or medication or something that needs to be prescribed, please get a prescription. Even something as simple as birth control, being on the pill, don't take it for granted and go and pick up in the pharmacy unless they have a pharmacist who is trained to educate you on the options. And then the ones that are providable in the pharmacy, they can help with the prescribing. And that's only specific facilities that have that ability to do. A lot of pharmacies have pharm techs who are not doctors. Pharmacist is the doctor. Again, you have to understand. So the same way, medical doctor trained, you will find us on the registry. A clinical officer and nurse, that's a different cadre altogether. So you have to know who your provider is and what level of education they have so that you know who is the best placed person. A lot of people can't also afford direct care with the gynecologist. That's also a reality. You can be seen by the GP. If your issue can't be addressed by a general practitioner, then they'll refer you to a gynecologist. If you're in a government
government facility, for example, the gynecologist clinic is specialized, they'll have midwives see you, like in normal antenatal care.
Yeah.
For standard pregnancy, you don't need a gynecologist. You can be looked after by a midwife. If there's an issue with the pregnancy, an issue with the mom, something complicates the pregnancy, then a gynecologist is brought on board. So the care is there. The actual services and the service provision is there. You also have to do a bit of research on your own. Yeah.
I love it. Okay, so clearly there's a lot of resources that are available to us. On the one you've just mentioned on the pharmacy, I want to reference the example of the lady who was given a prescription from her doctor. It wasn't necessarily a gynecologist for her kid. And she went to the pharmacy. Just to mention why it's important to know the difference between a pharmacist and all this, right? And why you should be situationally aware.
Yeah.
This lady was given medication and she was told to go and apply on the kid. So, of course, you know, your doctors, like, you worked hard to be number one, but handwriting class you skipped, right? So, she's been given a paper there. It could be jargon.
Anything.
It could be anything. She carries it, doesn't even ask the doctor, sorry, what is this? And she left with it, goes to the pharmacist, gives the pharmacist, and the pharmacist says, easily Colgate. Give her. Went to apply on the kid, and the kid is blind. Right? The kid lost their sight. Right? And she went to now ask them, why did you give me this? And the lady is like, actually, yeah, guy. I made a mistake. True story. Yeah. So for me, what I discovered is that, because antibiotics are a huge thing here in Kenya, and we're always telling Kenyans, don't take over the counter antibiotics without a prescription. So I tried it. I went to a pharmacist, and I was feeling, I think it was last year, fluish. There was a flu that was going around that was like, COVID, that, right? So I was like, I need something to take for this. And I go to the pharmacy, and she's like, I tell her, we didn't even have a deep conversation. I was just like, I'm feeling this, that. She's like, antibiotics, you take this 3 times a day. You can take this one. I think there's one called juice in the Janthropus or something. Right? And I was like, girl, stop. How you just gonna give me antibiotics I don't have a prescription? She's like, unataka kupona ama unataka kuendelea na hiyo homa? So that to me already tells me, sorry, I'm going to use profanity. This bitch doesn't know any, she's not a registered, but she's here with confidence telling you about antibiotics. So with those 2 examples, what I think is that as you're going to the pharmacy, if you have a prescription, please have that discussion with your doctor. Like, sorry, what is this? Just confirm the actual product, because the Famtech.
That's when you'll find it.
We didn't even know there was Famtechs, man. We're just like Famtech, pharmacist, Faminisha. Just call that babe front desk. So that we know that it's not medical. Don't put any farm shit on her, just or him. I to a front desk. To do a front desk, can I please speak to the pharmacist? Unataka, and then you ask her, read out loud what you are reading. And then when she says Zinjanthromax, then you say, honestly, I think there's one. It's called, there's a antibiotic.
Go close.
Then you can be able to, because I saw that situation and I asked myself, Poisons Board are the ones who are supposed to see, what do they call it? Society. They're the ones who are supposed to be ensuring that the front desk babe should only be asking me, hi, would you like some water to take with the medicine the pharmacist will give you? Period. But look, even touching the medicine shouldn't be touched. Maybe cleaning the table.
Very true.
Yeah.
Now, the challenge we have, of course, is resources. So Pharmtechs, just to clarify, they are trained to support the pharmacist. Usually in a professional pharmacy, the pharmacist is behind. You know how there's, whatever fancy pharmacy you've gone into, there's all these skincare things and all these random products at the front, supplements, then there's a desk, and then there's prescription drugs behind, and a person back there. That's the pharmacist in most places. Pharmtechs are supposed to support a pharmacist. Now, most facilities, especially all over Nairobi, don't have the capacity to have a pharmacist on board, or it's a pharmacist's pharmacy, but they've hired Pharmtechs to dispense. They're not allowed to prescribe. So you need to understand that. The other thing I say for patients, if you have a good rapport with the doctor, if you're going to, and especially if it's a different pharmacy from the facility you've gone to, have the pharmacist call the doctor. if they're going to change the medication. We are open to that.
Yeah.
Have them call, you have the number for the clinic, talk to the doctor and see if they can substitute. Because a lot of places we want to change a drug that is prescribed to something different or what they have on the shelves. And it could be a generic, it could be whatever the variation, but you need to confirm that with the doctor. So I do have patients who have the pharmacist call me back. It's just, it's a support. I should be able to support you even then to make sure the right medication is prescribed. So as much as we're doing a lot of putting a lot on the patients, we also as providers should be stepping up and saying, you know what, just as an extra precaution, if you can't find it in the pharmacy and they have something, they can call me to confirm that I'm happy to change to whatever they have.
I love that.
Yeah.
All right, so what's the cost of silence when it comes to reproductive health? Because everything we've spoken here is all boiling down to, as much as you're opening your legs, open your mouth as well. Talk to the doctor.
Yeah, exactly.
Make sure, and the conversation doesn't end there. It also goes into the pharmacy. It also goes into 2 days later.
Community as well. You're going to go and talk about your experience. And a lot of, like I said, a lot of women's primary experience with their provider is clouded by someone else's story. So you come in with this expectation or this fear based off of someone else. Because I'll have that conversation. It's like I said, we barely practice preventive medicine. So when someone comes for a checkup, it's the first time I can talk about a pap smear and you haven't had one before. I'll ask the question, so why not? Oh no, my friend told me when she went for hers, it was so painful. I would never do that to myself. And I'm like, so now that you're here for a checkup, one of the things we recommend is a pap smear. Are you comfortable? And I'll explain what a pap smear is and the process and what I expect you to feel versus if you're panicked and the concept of pain comes from. And we can actually get through. And majority of them will come out of there going, oh, that's not as bad as I expected. But because again,
there's some people
communication.
Pap smear. The bad they had was pap. Because they honestly, they do it painfully.
Yeah.
And the only reason I know this is because there's a time we went to the gynecologist for my annual meeting with my mom. And our gynecologist at the time, before I came to you, she's now aged. She can't do the procedures herself.
Yeah.
So she sent us to the doctor, to the main hospital. And I remember mine had done, because now I'd already met you, so I'd already I'd already had mine there. My mom came, so I took her to the clinic. And I remember she came, she was complaining. In fact, and my mom can complain, right? She comes from that generation. And she's like, yo, I'm in pain. I'm like, it took so long. And I'm like, girl, I think you're exaggerating. And I was basically downplaying. And she ended up not doing it. They did it for 30 minutes and then she ended up not doing it. So I think she was given a nurse or someone who has barely any experience. And just so painful. She was like, I forget this. And then she now went to another Gynae and which was done
without any
so imagine if that was her only experience, she would never have gone back. She'd be like, hey, it's too painful or whatever.
So you do need to, again, it's a communication thing. I found that a lot of patients, once they understand what the procedure is going to be and what to expect, you're able to relax enough that it's not, because it can be painful, especially that speculum. And depending on the facilities, some still use a metallic one. So those are horrendous regardless of what happens. Whatever happens, that is not shipped. I don't believe that was shipped for an actual female body. So the speculums that we use now, which are disposable, the plastic ones tend to be shipped a bit better. Plus, we have different sizes. So if we can't fit a normal size one, we can go smaller, we can go larger if we needed a bigger one. So it's all varied to the provider, the place that you're going to. Again, resources being an issue in some of the government or subsidized places. But then if you're able to afford private care, then you'll find that we have better resources, a bit better, more options for you. But even then, the provider should explain what they're doing and usually should be able to give you someone who has experience in doing it. It shouldn't just be, because there's a nurse, there's a standard nurse and there's a reproductive health nurse and there's a midwife. So these are different types of nurses who have training on different types of medicine and they can support the provider, the doctor, because some places it's too busy for the doctor themselves to do it, but there's a trained nurse in reproductive health who can help us do the procedure. So again, it's about the person, the training, the communication ability. It should not be painful. That's the thing I'll keep emphasizing. A pap smear is not supposed to be painful. It's uncomfortable. There's no taking away the fact that it is quite the uncomfortable procedure, but it should not be painful.
When should someone go for so just to be clear, what's the cost of silence when it comes to reproductive health?
life and death. It's a life and death situation because depending on what the symptoms are, what the issue is, and the fact that we're waiting to have an issue, it can be life and death. And I'm talking both obstetrics where a baby's life is on the line as well, or reproductive health, just where you're a gynecology visit and you've never had a pap smear and you come in with symptoms, and I'm telling you it's a cervical cancer. And again, we're diagnosing cancers much younger than we did before. I think it's environmental changes. We are consuming more alcohol, drugs, smoking, just quality of food as well. So we are seeing more cancers earlier than what is expected. So if you're waiting to be told that you have cervical cancer in your 60s, we've seen patients coming in the early 30s. So it's something that if you're not coming in, if you're not having your checkups, which you should just give yourself a once a year checkup so that you have the baselines of the comfort of knowing I'm fine, or something was picked up and it was treated and now I'm okay. That's what I would recommend.
And so now that we know that, yes, once a year, you should treat yourself, go to the gynae before you book that trip to Coastal or Maldives. Eh? And wait, there's another conversation we should have. I just remember because I'm about to go on my vacation for my birthday and I'm having all these challenges with swimming pools. But you know where my mind is at, right? Yeah. Exploring is not it. But when should someone make their first visit? Now, now that you've had this, or of course now you had and you're just like, okay, I'm really late. It's not too late. But when should someone start going to the gynae?
I will take this opportunity to commend my patients who bring their daughters for their first visit as they enter their teen years. That should be ideally your first contact with the gynecologist. And that's mostly because we now have preventive ways to treat you. So if you bring your daughter in preteen, teen, we can start on HPV vaccination, which then gives her lifelong protection against cervical cancer. So again, we're not waiting to be sick. We're not waiting to have a symptom to address it. So if you can bring your daughter, your niece, whoever it is who's younger, now we're talking maybe from age 12 onwards. Again, remember, you live in a country where we don't have sexual health and reproductive health education. Your first gynae visit could just be teach her what her period is. Teach her what's coming. The breasts have started to show what's coming next. If you don't have the capacity, because you were not taught, how are you going to teach the daughter that you have? So then the gynecologist comes in as an extra tool to help you have these conversations with your kids. So ideal setting, I'd say come as a teenager so that we can have the first conversations. If we need to address any menstrual issues at that time, if we need to address any health issues that you're having around the changes that are happening with puberty, that's the ideal time to come. If there's any vaccinations we need to get you on, it's controversial, but imagine this is not the space for anti-vax. It's not the space. Again, anything that's to help you prevent you having a major horrific disease later on, then we are able to start the planning and prevention early. Especially if you have a strong family history of certain diseases, you should be seeing the doctor, the gynae, as early as possible, so that screening can be started as early as possible, as well as preventive treatments. There's some people who have very, very high risk for breast cancer because of the genetic mutations that run in the family. That's something that can be taken in your history, and then preventive measure screening or preventive surgeries can be planned. So there's things that can be done from very early on. Now, unfortunately, for the majority of the audience, they've passed their teen years, I'm sure. So it's as soon as you've seen this conversation, it's as soon as you've had this conversation that I should have seen a gynae by now, start seeing your gynecologist. The average, I'd say, in my practice, first visit I have tends to be 28 to 32 first visit. And I'm like, that's really pretty late.
Wait. No. Okay, I get it. I get it, but you need to start now, right? I love it. Thank you so much, Doc, for coming through. And you guys, if you want to know more about reproductive health and you want to know more information, because Dr. Claire has her own podcast, it's called Circling the Rabbit Hole. After you finish this, you can go check out her podcast because she talks about there's so many other things. Guys, we haven't even scratched the surface, but she'll be back here on Boxpod so we can talk more about this down there. No, because it's important. It's important. And also for the men who've watched this till the end, I want to appreciate you because you've learned a thing or two, about reproductive health, and it's important because and also you will have daughters, you have sisters, you have mothers, it's important to know what's going on. So when people want to follow you, give them your handle.
Social media at Dr. Claire Kinuthia or at CTRH _podcast. We'll put all the details.
That's in case you're wondering what the abbreviation is for. It's Circling the Rabbit Hole.
Yeah.
So check her out. Hey, this one has been nimefurahia sana kustay mambo. And especially on a nice Monday when we've recorded. The episode will be out on Sunday, but we record on Mondays. Kaba.